Let's start. Okay. Hello. My name is Dr. Gopinathan Raju. I'm the consultant anesthetist and a pain specialist. Today, I'm going to share with you a case I did. This is a 58-year-old gentleman who presented with chronic low back pain for about 1 year duration. This patient had a sudden onset of pain after he went to gym when he did a deadlift, and he had a shooting pain going down his right, both sides actually, more of the right L4, L3, L4, L4, L5 dermatome, with burning pain and also mechanical back pain. Now if you look at his x-ray, it's interesting to note that he's got an extra lumbar, we call it the lumbar sacralization. It's actually the L6. You can see that's the L6, L5, L4, L3, L2, L1. Now if you can focus here, you can see that L3, L4, there's a loss of the disc height, and you can see lots of osteophytes and a lot of degenerative changes. Okay. In the MRI, basically the whole intervertebral disc is thinned out, and it's got a disc bulge centrally, which is causing narrowing of the both exit foramen. And what you can see, what I've done is basically I did a radio frequency ablation of all the facet joints, starting from L5S1, sorry L6S1, L5, L45, L34, and L23, right? So, and also I also before this I did Caudal Epidurolysis with a catheter in situ, and I did a pulse radio frequency of the dorsal root ganglion. And you can see the images. This patient was when he presented to me, he was in quite a lot amount of pain. Pain score of 7 out of 10, and he has a lot of muscle deconditioning on his back muscles. So very poor balance and poor gait as a result of this pain. And so what I did is, I can see this is the radio frequency on the left side, which I did, and again you can see that mark around the L3, L4 with the loss of disc height and loss of the entire vertebra and a lot of osteophytes. This patient actually not keen for surgery, so he wanted me to fix his pain, which I think he would have benefited from this pain from the procedure. As you can see, I use a caudal epidural approach into the epidural space, and that's a catheter, which is a spring guided catheter. And what I'm doing is basically I'm tunneling the catheter along and trying to release any adhesions. And here I use something called chemonucleolysis using hyaluronic acid to break the adhesion. Along with that, I'll give a mixture of triamcinolone with ropivacaine 0.2%. And you can see the dye spread. It's a very nice spread of the dye centrally along the epidural space. And you can see that's the lateral view, very nice view of the catheter in the anterior epidural space. So you can see the catheter lining up, and then you can see the epidural spread of the contrast. And I was really concentrated on getting relief at this point, because I think it's L3, L4 has a lot of symptoms. So this is to show you that these are the procedures I do in my clinic. I've done quite a fair bit, a number of these. I must say I've quite a good results. About 60% of my patients gets about relief anywhere between a year to more than a year, at about 50% reduction of the VAS. But of course, I also put them on an intense exercise program. The key thing is to strengthen their core back muscles, because once you strengthen those muscles, you can overcome lots of this pain. And I did tell the patient that if this procedure did not give him very relief, we need to consider something more invasive, like a surgery. But he is very keen to have a go, and I'm quite certain would have managed to relieve most of his pain. Thank you for watching. Kindly visit my website at www.thecaudalepidurologist.com. paincare.com.my. Thank you.